Hi, my name is Gregory Vidal. I'm a breast medical oncologist at the West Cancer Center and Research Institute. I'm also the director of clinical research and the chair of One Oncology Breast Program. The question is, what are one or two most impactful developments in breast cancer? I will say the most impactful is really the HER2-low space. It has essentially changed the way we think about breast cancer. Some may argue that we've created a different class of breast cancer, but it certainly has impacted the way physicians think and manage those patients. So what is that? HER2 by immunohistochemistry has traditionally been considered positive when there is high expression 3+ or 2+ with FISH positive. And the HER2 low, we've known for many years that trastuzumab has not been effective in that population. Now, taking a more targeted approach with TDXD, which is a biosimilar trastuzumab with some chemotherapy conjugated to it, we now see that in DESTINY-04 that there is not only progression-free survival, but overall for survival, utilizing an antibody-drug conjugate approach in that patient population, both in the ER, mainly in the ER positive, but there also seem to be efficacy in the ER negative space. So it's now, we now have another drug which is very active with overall survival benefit, but it forces us to think about our patients in a completely different way than we're traditionally accustomed to. And then there's another ADC, and I think ADC is here to stay, and we're going to have more and more development of ADC with different antibody chemotherapy or antibody immunotherapy combinations. So I'm looking forward to that. So that's another development. But we have sacituzumab govitecan, which is an ADC in a similar population, regardless of HER2 expression, that appears to have efficacy. But when you look at the HER2 low space or HER2 zero, it has efficacy across the board, which I suspect TDXD will also prove to have. So development of ADCs and the HER2 low space are probably the two most impactful changes that are happening in breast nowadays.